Hello, I'm Dr. Alan Grant. What is your name?
Hello, Dr. Alan Grant. I'm Ted Berry.
Ted Berry. Nice to meet you. May I call you Mr. Berry?
Of course.
Great. So I'm going to be gathering your medical history and inquiring about your illness. Is that okay?
Okay.
Great. So let me get started here. What brings you in today?
Actually, Doc, I have been having this back pain.
Okay. Tell me more about this pain.
I've been really feeling distressed because of this pain, and I can't seem to get comfortable. I'm persistently nauseated, and it's just a sudden severe pain on my right back and just radiated down to my right groin for the past 2 hours. It actually feels like an ice pick, that sharp stabbing squeezing pain.
And this happened suddenly?
Yes, it was pretty sudden. There were no triggers at all.
Okay.
And I've been also feeling nauseous. I vomited twice. It was a dark vomit, but it wasn't bloody, thank God. And I've been sweating a lot, and I've been feeling like I have to urinate, but nothing can come out. And I haven't had any BM for the past 2 days either, or past gas, not that I've noticed.
Okay. And how would you describe this pain?
Like I mentioned before, it has that squeezing, sharp, stabbing, and crampy pain.
Is there anything that makes the pain better or worse?
Well, walking makes it seem not so bad, but I still can't get comfortable. There's really no position I can assume that makes it better. I've tried a heating pad, it didn't make it better, and I've taken 800 milligrams of ibuprofen also, and that didn't do anything.
Okay, and where would you put your pain on a scale of 0 to 10? So 0 is no pain, 10 is the worst pain you've ever felt in your life.
It's about 10 to 10, really. It's one of those that just comes and goes by itself. It's a wave of pain, and it just makes me want to throw up. It's that excruciating.
Okay, well, I'm sorry to hear about that, but we're gonna try to get to the root cause of this back pain, figure out what's going on. Right now, though, I'm going to transition to a different part of this interview, so we're going to ask more about your past medical history.
Okay.
So the first thing is, do you have any previously diagnosed medical conditions?
Yes, I do. I actually have gout, and I ended up getting an appendectomy when I was 12 years old.
Okay. Are you taking any medications?
Yes, I am taking 20 milligrams of lisinopril 2 times a day for my blood pressure, and I'm taking 50 milligrams of indomethacin as needed for my gout.
Okay. And do you have any allergies?
Yes, I am allergic to hydrocodone. It just causes me to itch and it gives me a rash.
Okay. Any tobacco or alcohol use?
Mm-hmm. I smoke tobacco about half a pack a day, and I occasionally drink alcohol, but that's just on occasion during parties or events, but I don't use any drugs.
And are you aware of any medical conditions that are present in your family?
As far as I know, my grandparents all died of old age. My mom and dad died in their 60s of heart attacks. My brother also died from a heart attack when he was 52 years old. And my spouse has type 2 diabetes. And as far as I know, my children are doing well.
Okay. Well, thank you for your time. I'm going to use this information to hopefully we can utilize this to try to come up with a diagnosis, and we'll perform an exam here shortly just to try to figure out what's going on, and we'll develop a treatment plan based on that. Just give me a call if you have any further questions or concerns.
Okay, thank you, doctor. It was nice meeting you.
Nice meeting you too.
Thank you. And scene.
Hello, this is Matt. So what you just saw was kind of an example of a patient interview. So it's like what we're expected to give all throughout medical school. So we have these kind of practice patients, and they give us this information, and we have to record it and be sure we're asking them the appropriate questions. So, of course, this was highly abridged. The real thing is much longer. There's many more questions that would be asked, and way more information that would be gathered. But this kind of just gives you a taste of a sample, if you will, of how to conduct a patient interview and how it should start out.